Okay, let's go.
Do it! Just do it! Jump!
My name is Nurse Jelani. Welcome to another edition, the second edition of Citizen Nurse and Friends. And I'm so excited that you're joining us today. And I have a special guest who I've been wanting to talk to for a long time. We've known each other, I want to say for a couple of years now, but it's always just been quick, hello, how are you? Or, interacting through social media. And that's the power of social media is, you get to meet people and make great connections. And without further ado, I would love to introduce you to Dr. Darcy Burbage, who is an oncology nurse, but I will let her tell you more a little bit about her background.
Oh, great. Well, thank you, Jelani. I'm so excited to be here with you today. And I just want to congratulate you on all the amazing things that you do and your recent award for advocacy from the ANA. So that was such an honor for me to see you recognized for all your work. So what a pleasure. But my background, I've been an oncology nurse for over 30 years. I started my career as an oncology nurse. It's not where I thought I would be, if that makes any sense. I didn't see oncology as where I was headed in my career, but I really believe our specialty area chooses us. So I feel like oncology nursing chose me, and I have loved it since day one, and I still love it all these years later. I've been in many different roles in my career, started out as a bedside nurse, and then went into our ambulatory setting, infusion center, worked in clinical trials, community outreach, radiation oncology. As a CNS, I started our navigation program actually at the health center that I worked the majority of my career at. And I think that was the best job I ever had because I got to develop the program. There was no job description. It was kind of like, I remember my VP saying to me, just fix it, just fix this. So it was great to come into a role where you could just bring your authentic self and put something together that really made an impact on our patients. And, I talked with patients that I had cared with over the years saying, tell me what you think a nurse navigator does. What would have helped you when you were going through your cancer diagnosis? And it was just such an honor, and I loved that role, and that grew in our health system where I was the first, and it grew to like over 20 navigators in many different in oncology, both inpatient, outpatient, and they started navigation roles for some of our other chronic illnesses. So it was exciting to see the evolution, and certainly what has been the Oncology Nursing Society and AONN doing a lot with navigation, and I've been privileged to be part of that. And that kind of ties back into advocacy, I think, because we had to advocate for that position and additional positions about the importance of that role and how it impacted patients, and how we could grow that role to help even more individuals living with cancer throughout the continuum of care. It's been a great honor to, as I said, be an oncology nurse.
It's a privilege, I think. To work with patients just in the nursing role, but especially in an oncology nursing role, because it's such a life-altering diagnosis.
Right.
But thank you. Wow, that's an amazing, especially with navigation. I think in many ways it's still kind of, a lot of organizations are still trying to figure it out because there's so many specialties, there's so many subspecialties. So it sounds like the work you did, especially setting up a navigation program. It's kind of, that's also like being a pioneer.
Right, from the ground up.
You mentioned the Oncology Nursing Society, ONS. And I know that they've been great supporters of nurses in advocacy, but I think, as you mentioned too, nursing and advocacy just kind of go hand in hand. But some nurses don't know that what we do is we just advocate for the patient, not just carry out orders, but in all these actions we're advocating. And being part of ONS allows us to have like some sort of formal structure for it, and be with our peers who are all for it. So, and that's how I connected with you, was through the professional organization and through their advocacy group. How long have you been a member of ONS?
Wow. Well, when I began my oncology nursing career, I was an LPN. So at that
Okay.
time, I went to a high school program. I was one of those people always wanted to be a nurse. So in our community, there was a vocational high school. So I started out, went to that high school and was an LVN. So we weren't allowed to join at that time. But as soon as I was able, I finished my associate's degree and then, professional student, bachelor's, master's, etc. So as soon as I was able to join ONS as an RN, I did. So it's since 1990, I think I've been an ONS member. So for a really long time. I remember even before, if we're talking about advocacy, I think, we both know Alec, and he's been such a great part of our advocacy journey. But even before Alec, there was a person at ONS, her name was Elisa Halpern. So she really piqued my interest in advocacy. I remember going to a fall meeting and she talked about, I think it was tobacco at the time and some of the tobacco legislation. And she passed out these cards. And if we wanted to sign up and get emails about advocacy and legislation, we could do that. So I started getting involved with that and receiving the emails. And kind of around that time, believe it or not, in our health system, and I'm probably not alone in this, people could smoke in the hospital, in break rooms, in patient lounges. And it was like, what? Why are people doing that? So I became active in our health system to eliminate smoking within the health system. So I started to get involved myself and some other nurses. And, we received some pushback. People were like, believe it or not, it was, oh, but they have cancer. It's like, wait a minute, so it's just more than that. So you really had to, I'll borrow this phrase, speak truth to power. So we, I think, advocacy is just a real world example of evidence-based practice. We bring our clinical experiences, we bring our patient voice, we bring the data when we're talking to our elected officials or to others to say, this is why we support this, or this is why we are asking you to reconsider. So, luckily, thankfully, it was outlawed. Is that the best? I don't know if that's the right word, but it's no longer allowed to be smoking within the hospital setting. And when I tell the story, people they can't believe it, who are some of our newer nurses, that happened. And in Delaware, it kind of transcended into having a smoking ban in all indoor facilities. So I remember calling our legislator and say, I support this because of, it's bad for, individuals, secondhand smoke. And I remember saying, and I'm also an oncology nurse. And let me tell you about some of the patients I've cared for that have developed smoking related cancer. So, all of that started my advocacy journey, and that kind of grown with oncology nursing, with Alec and his passion and really helping us find our voice. And certainly now with Jamie, who continued that legacy to ensure that the voice of the nurse is heard at legislative tables. So we're bringing what we know as our clinical expertise. We're sharing the voice of the patient and their stories. So our legislators will recognize how important it is to the patients that we care for. And, that's my why. I want to share stories for individuals who aren't able to share their stories, speak for them, and get so individuals don't have to experience what they did, what they went through. So that's all part of what we do as nurses, not only share our patient stories, but also make sure the voice of the nurse is heard. We're the most trusted profession and have been viewed that way for 20 plus years. So we really need to speak up, speak out, speak often about things that impact us as a profession and the patients that we're privileged to care for.
Gosh, Darcy, your passion just for nursing and for advocacy just like shines so much. And
something that you just said too that just reminded me that some of my peers or some of nurses will say, oh, I can't do that, I can't advocate, I can't speak. We, as you said, we advocate for our patients every day. If it's for treatment plan, improve symptom management, if they need resources at home, we do that every day, and we tailor our message to the audience, right? If we know there's a certain person, we have to approach it a little bit differently, but the message is the same as long as we get the information out to help our patients.
Yes, and the amazing thing about nurses is, and I attribute this to Alec, but Alec Stone, he was the gosh, I'm forgetting his title, but it was like the government affairs director of the Oncology Nursing Society for many years. And I remember him saying nurses are interesting in that when they go to Capitol Hill, they don't even advocate for themselves; they advocate for patients. But I think the time has come now, especially because of the pandemic. We have to take that step forward and ask for things for ourselves as a profession. And I think that's happening. There's other professional organizations that are doing that. But if we don't ask or if we don't advocate for ourselves or our profession, somebody else is going to speak for us, and we may not necessarily want them speaking for us, right?
That's right. That's right. Yeah. And I know both you and I are active in our local nurses association, you through California, me through Delaware, and you just really reminded me, speaking up for our profession, if it's safe staffing, that protects our patients. It also protects us as healthcare workers, protects our license. We want to provide safe care. Also, APRN regulations, workplace violence, my goodness. All of those things that we really need to advocate for ourselves as a profession to ensure that, we're providing the best care we can to the patients, but it starts with us, and that's not selfish, is to,
Selfish, no. Yes. We have to take care of the nursing profession, because that's how we're going to keep growing nurses, and that's how we're going to keep caring for our sick patients out there, or even, as the nursing profession ages, right? My thought is always, I want to instill this knowledge and make sure that all these things that we're doing is passed on to the next generation, because I'm going to end up in that hospital bed, I'm sure, somewhere down the line, and I want to make sure that I've taught what I've learned to the next generation. But I want to go back a little bit. You talked about speaking to your legislator when it came to changing smoking in your organization and all of that. How was it when you first, had that experience, like sitting down, talking to your legislator? How did you feel?
Well, of course I was nervous. I just felt so intimidated. I was like, oh my gosh, what will they think of me? Will I get all tongue-tied and not be able to say anything? But immediately I felt at ease, because when they came in, they were, so grateful that an oncology nurse took the time to come to their office, and immediately were like, oh, tell me a little bit about this. And very interested in what we had to say, very wanted to hear, our experiences, wanted to hear, the data we had to support that information. And, you have a very short period of time because they're super busy too. So just having that elevator speech of, this is, who I am, I, constituent in your area, right? So I think that has a little bit of power, because we help elect them. So they want to hear what we have to say. After the first time, I was hooked. I was like, oh, wow, they really respected me, the profession, and what I had to say. So, it was just the next time I was like, just sign me up. I was ready to go anytime. Fortunately, I've been to every Hill Day that ONS sponsored. So thank you to my local chapter for supporting me. But I'd like more of my local chapter members to participate and get that, energy from sharing your expertise and your patient stories, and, having that conversation with our legislators, because they really do listen and ask questions, and they know what's going on too. So if you don't get the opportunity to speak with your elected officials, the individuals who represent them are just as important, and they have the ear of the legislator. So, certainly be respectful of them and share what because they know a lot as well. So feel comfortable in that role, feel empowered as a nurse to share your expertise with the legislative aides, legislatures themselves, or if you don't feel comfortable, if it's writing an op-ed or something that you can share that information sending an email, posting on social media. So ensuring that you have the data, you're respectful, that you have that information, and you are knowledgeable about the information that you want to get across to the individual that you're speaking with. Just like if you're speaking with a physician colleague or an NP colleague, you want to have that data and the information so they can make the best decision. Hopefully it's what we are asking them for. But it's just share our voice. So just to know that we're being heard as nurses, that we're sharing that information, the correct information. So I think that's really important. And they, as we talked about, Jelani, we have that trust behind us. People trust us as nurses, and I take that to heart. Of course, I'm going to make sure that I share the information and that it's okay to say we don't know. So if they have a question and say, "Gosh, I really don't know, but I'll get back to you," and then get back to them with what they ask you as well.
Yeah, that's great. And you're right. You absolutely get hooked. And it's this really interesting shift from being intimidated and nervous, and then sitting in that room either with the legislator or the person that's representing them, and really feeling like they're hearing you, and where all of a sudden it's like this dynamic of where you're the subject matter expert, right? Like they may be the politician or the representative of that office, but in terms of the nursing profession and what you do and what you came there for, you're the subject matter expert. So it's almost like you go from being intimidated and nervous to, yeah, I got this. I know this. I know what I'm talking about.
Absolutely.
I liken it, and I've shared this many times before. Like the first time I met with my legislator's office, and it wasn't. I think I was with another person, but it was almost the same experience when you're in nursing school, and the first time they assign you to a patient, and you're doing this, basic head to toe assessment, like very very basic. But I remember I must have walked up and down the hallway for a couple minutes before I even mustered up the courage to go into the room. So I likened it to that. So I was like, and then going on my journey as a nurse, I mean, that just comes as second nature. You just go into the room, you introduce yourself, and, you grow in the profession. Current advocacy related projects are you working on or interested in working on at the moment?
Well, I'm very interested in, going back to tobacco, the vaping issue. I think that is really important, for, especially the teenagers that are participating in that. I really think we need to speak up about that. Everywhere I go, at least in my community, there seems to be vape shops. And I don't think people realize how that can impact someone's health. That's very important to me to share that information and get that word out to our legislatures. The other thing that I'm very passionate about is safe staffing levels. I see my colleagues that are still at the bedside or at the chair side, really struggling with, just being overwhelmed and burnout, but they don't want to let down their patients. They don't want to let down their colleagues. So those are some things that I'm very passionate about, reducing workplace violence. So anything we can do to improve safety of our colleagues, safety for our patients, and the community too. I think that's very important. So those are some things that I'm actively involved in, and also through the Delaware Nurses Association. The legislature just closed for the year, but there were some projects we were, working on through that group that will continue on when they reopen later in the fall. But in Delaware, it's similar to what we have in other places too. We want to ensure that access to mental health for healthcare providers, not just nurses, but all clinicians as well, and also for patients, so we can have access to needs and have those needs being met for our patients, for ourselves. So I think those things are really important, and also the practice regulations as well. I think for APRN regulations, there's always some legislation happening where bills are introduced that want to take some things away from our APRN. So I want to make sure that the voice is heard, that we share the data, we share the patient stories, our own stories of how we're all in this together. So, just to, have that conversation that we can, we're all in this together to help our patients. physicians. It's not, one against the other. It's all of us in healthcare that we want to provide the highest quality care. So those are some things that I'm very passionate about and hope to continue on. So
Yes, yeah, and thank you for the work you've done. I know you're very active with the State Nursing Association as well, and I think it's important for nurses to partner with nursing associations, wherever their heart is, whether it's specific to their practice or their specialty, or on a state level. And there are national nursing associations as well. But it's about
I'm
community.
sorry.
Oh,
Oh no,
yeah,
I was going to say too, just things that we advocate for. I think of it just as ongoing with oral cancer
yeah,
parity. My goodness, Pachita.
yes, yes.
Some those things as well that we're always doing, but we want to see those bills passed very very
Yes,
soon.
yes.
So I'd be remiss if I didn't mention them. So I apologize for.
Oh, no, no, the oral cancer parity, and what that is for people who are familiar with chemotherapy. Traditionally, it's given through the vein, but there are many cancer therapies that can be given other ways. So there's works and a lot of advocacy going on around getting chemotherapy pills basically covered by insurance, or raising awareness on cost and all of that. So that's something that the Oncology Nursing Society has been working with a long time, and it does take years sometimes to get legislation passed. But it's if we don't bring it up, who else is going to bring it up, right? There's so many voices at the table. There's so many you might think, oh yeah, who wouldn't want patients to have, an easier way to take chemotherapy with less side effects? That would be like to us nurses, like a no-brainer. But yet there are other voices out there that maybe have like 50 ways to argue against that. So it's about having a voice, because if we don't speak up, someone is going to speak up. I think the era of nursing in general, just thinking somebody else is going to take care of it for us, is over. Like, we have to really take care of it for ourselves. Is a privilege, really a privilege to be in that moment with that patient. It really transforms you. And how can you not speak up and advocate for someone like that? You really do them a disservice if you don't tell their stories and their struggles, and how can we make it better? But yeah, thank you for just sharing everything that you're doing. And if you don't mind, maybe in the future I'd love to talk with you more again, because I know there's so much wisdom you have, and just so many stories with advocacy, and everything that's going to be happening in the next year with your planning for the conference. So if you can have a takeaway for people watching this, in terms of how nurses can get involved in advocacy, what would your takeaway be for that?
Wow, that's a toughie. I think a takeaway would be is, whatever you're passionate about, there's an opportunity for you to advocate about that. If it's for, palliative care, if it's speaking up for environmental health and how that impacts cancer care, I think it's, become that expert in your clinical practice, on social media, and with your legislatures. So if there's an issue that comes up, they're contacting you. They know that, they'll get the real story, they'll get the evidence, they'll get the patient's story, they'll get the nurse's clinical background, so we can all work together for sustainable changes to make things better. So I think that's, my takeaway. And also too, it's just, our voice is so important, and we all have a voice. And to, as we said so many times already, Jelani, speak up, speak out, speak often, share your experiences, and feel empowered, because you are powerful. And without an engaged nursing workforce, we're powerful in numbers to share how we can reduce health inequities, bring that voice to the table as often as we can. So you can do it.
You can do it. And in case no one has told you today, nurses out there, you are powerful. You've heard it from Darcy and me today. You are powerful. Step into that power. And
Yes.
it's interesting when you decide, okay, I want to advocate for this, or I want to do this. You kind of fall into a community of like-minded and passionate nurses, because all the connections I have, you included, is really just because I wanted to make a change and I wanted to do something. And you look for mentors, you look for people that have been doing it. What I found, and what I really enjoy enjoy about this community is that nobody is like trying to hoard knowledge. Everybody's like always wanting to share, like, this is what you do. And, that I think it's great. It's a way to learn what's happening at various locations in the state, but also in the nation. And every opportunity is a learning opportunity. I think you can be doing this for years and can constantly learning. Especially, as our senates and assemblies and representatives like turn over, right? So it's building those relationships, which nurses are really good at anyways. We build relationships with our patients, with our colleagues in the hospital, and with families. So, we hone our skills, and it's just being in a different location. That's all.
That's right. That's right.
The halls of hospitals, the halls of Congress.
That's right. You have 100 oncology nurses coming. Get ready, right?
That's right. Yeah. Actually, it's probably you have more support because when you're in that room with the patient doing your assessment, sometimes you'll have someone to help you. But if you need to turn the patient or start an IV, but when you're in your congressman's office, you can have up to like 5-6 people with you sometimes, depending on the size of the office. So you have friends and you have support, and getting to know your local their local offices is so important as well because they live in your community. They know what's going on firsthand. So that's a very important thing to do as well. And then just something to share with our nursing audience here, or any audience, whoever is watching this. What do you do? Work-life balance. Nursing, I think, we always want to have some work-life balance, and mental health is at the forefront, not just with nursing, but with any profession, with anyone these days. But what do you do for yourself to keep balance, and to keep refreshed, and to fill your cup?
Well, I have a couple dogs. You probably can hear them a little bit, but a pet mama is a big thing. I love to travel. I've been fortunate to travel internationally, so I love to do that. I also love to cook and bake, so I do that. And one year, I won a blue ribbon in this Delaware State Fair, so I was very excited.
Oh, wow.
So,
congratulations. What?
My claim to fame, right? Reading is another pastime for me that I really enjoy. So a lot of different things. And I think we have to make time for that too. It's easy just to, think, oh, well, I'll get to that later. But, certainly I love doing all things like that. And I try to exercise, but I'm not as good as I need to be. But just even walking. So just walking I'd like to do. But so if I can walk the dogs, that's two things that I like to do.
Well, thank you so much, Darcy, for just sharing your advocacy experience and lots of lessons that I've learned from that. And just keep doing what you're doing. You're doing great work and inspiring many nurses out there.
Thank you. I mean, you're just doing amazing work with your platforms on social media. I know I've learned a lot. I look forward to all your posts. So it's a pleasure for me to talk with you on your podcast. So thank you for inviting me. So looking forward to seeing what other wonderful things you'll be doing.
Well, likewise, Darcy. Maybe we can do, once I refine this a little more, maybe we can do like a cooking and advocacy like podcast, right? Well, you bake something and then
There we go. We can put a message in it, right? Speak up. Speak out.
That's right. Awesome. Well, Darcy, for your time. Have a wonderful rest of the week. Please like, share, and subscribe. And thank you for watching this episode of Citizen Nurse and Friends.